Yes, the time is 2 o'clock, so now we're ready for this digital event with BioPorto, following the release of the first quarter report from the company. My name is Henrik Ekman. I'm equity analyst here at HC Andersen Capital. And with me today from the company, I have CEO Tony Perret and CFO Neil Goldman. Before we begin, just a quick reminder of the format. As always, the audience is welcome to pass any questions in the chat box, and I will do my best to try and forward these questions to the company later on in the Q&A session. But before we come to that, I'll hand over the word to the company. So a very big welcome to the both of you. I know you're up early in the States while we are in the afternoon here in Denmark, but I'm sure you have a lot of interesting things to tell us from the latest quarter. So with that, Tony, take it away.
Thank you once again for hosting, Henrik, and a warm welcome to everyone participating on this Q1 2022 earnings release call. We are thankful that you have chosen to spend the afternoon with us to review our latest quarterly report. As some of you know, my name is Tony Perret, and I joined BioPorto as CEO 6 months ago. With me today is Neil Goldman, our Executive Vice President and CFO, who joined BioPorto at the same time. Before we begin, let me remind you the company's remarks made during this conference call, May 11th, 2022, may include predictions, estimates, and other information that might be considered forward-looking. Just move on to one more slide. Thank you, Henrik. Looking back at the first quarter of 2022, I am happy with the progress and achievements we have made during Neil's and my first full quarter working with the team here at BioPorto. We have delivered strong performance in sales of the NGAL test with a growth of 70% over the first quarter of 2021, including an impressive 116% growth in the US for research use only sales. To me, that is one signal that we are gaining customer interest in the important US market. However, I do want to temper my excitement with the fact that not all customers order every quarter. So these results may, to some degree, reflect the benefit of timing on some of these orders. Furthermore, and even more important to the future of the company, we continue making solid progress in the enrollment of patients for the FDA application for pediatric use of the NGAL test. Therefore, our guidance in this regard has not changed. Specifically, we remain confident that we will complete the targeted enrollment of patients by the end of June 2022. This is a very important step in the assembly of our submission package, since it is completely reliant on factors that we can't totally control, which is the ability to find and obtain consent from patients to participate in a clinical trial. We will then finalize analysis of the data to support the FDA filing. Concurrently, our teams are focused on completing the submission documentation and preparing quality assurance and production to launch the NGAL test in the US. The NGAL test has been granted breakthrough device designation by the FDA for expedited review. Breakthrough device designation is granted by the FDA for devices that provide for more efficient treatment or diagnosis of life-threatening or irreversibly debilitating human disease or conditions, and where neither approved nor cleared alternatives exist. And finally, a highlight of the quarter was successfully securing a fully subscribed share offering. Funds transferred April 1st with net proceeds of 93 million krona, which provides runway for the execution of our strategic targets. Let's turn back to our strategy. During 2022 and into 2023, our attention in BioPorto will be on preparing for the launch of the NGAL test in the US, initially for pediatrics and subsequently for adults. Along the way, we will work to sustain our other revenue streams and continue to develop a pipeline of potential new products. But let me be clear, those other activities will never take priority over our focus on a US launch of the FDA cleared product. And that is the theme in the first pillar of our strategy, which is to drive NGAL test market adoption and have a pipeline of high medical value products. First and foremost, completing the clinical trials and submitting an application to the FDA. In the meantime, we will generate NGAL awareness by promoting its use in the rest of the world through our distributor partners. As we get closer to launching in the US, we will invest in the US commercial team and pre-market to key target accounts. We have recently made investments in some business development and marketing personnel in the US. However, we will be conservatively balanced in this regard, leaning in with additional investment following our FDA submission and when we get some sense of approval timelines. Our second pillar is to strengthen the company to scale and execute. We do so by investing in our production, quality, and documentation systems while solidifying our supplier relationships. We have completed audits on our quality systems to identify gaps and to ensure that the company is FDA audit ready. It also means focusing on our core business operations and financing of the company. Our third pillar is to attract, develop, and retain the best and brightest of employees aligned with our values. Building the team for the future of BioPorto, we need to recruit the very best to help drive success. As people are becoming increasingly selective, it is our job and goal to constantly ensure BioPorto be a company where employees are motivated to join and stay. Having painted a picture of where we are going, let me bring you up to speed on where we are in the regulatory process for getting clearance on the NGAL test in the US. In November 2021, we stated our expectations to complete enrollment for the third part of a 3-part clinical study to support FDA submission of the NGAL test for use in identifying children at risk of AKI by the end of the first half of 2022. As I shared during my introductory comments, I am happy to reiterate that we remain on track to do so. The participation of 15 top hospitals across the US to conduct the enrollment has been very fulfilling. Being such a pivotal element of our strategy and value creation, I am very pleased with our R&D and regulatory team's ability to drive and deliver on these important milestones for the company. After completion of enrollment, we will proceed with data analysis to assemble the clinical support documentation portion. This clinical package is combined with all of our bench testing protocols, analysis, and documentation to form the de novo submission package for FDA review. As you know, the review process can take as much as 150 calendar days to complete, not including where the clock is stopped to answer any FDA questions that arise as part of their review process. At this stage, I'll turn the call over to Neil for a breakdown of the Q1 2022 financials.
Thanks, Tony. I'm also glad to be here to present the financial figures for the quarter. For the quarter ended March 31, 2022, revenue was 6.5 million kroner, representing a growth of 17% compared to the prior year period. Our Q1 2022 revenue was the highest first quarter revenue in BioPorto's history. Most of the growth reflected strong sales of the NGAL test, which totaled 3.7 million kroner during the first quarter of 2022, compared to 2.2 million kroner in the prior year period. ELISA kit revenue increased during the first quarter of 2022 by 138% over the prior year period to 0.9 million kroner. Combined sales of the NGAL test and ELISA kits more than offset the 1.1 million kroner reduction in antibody revenue compared to the prior year period. Antibody revenue was consistent with our expectations in the absence of an individual bulk order during the quarter. I'd like to share further details on sales of the NGAL test in Q1 2022. Notably, sales in the US totaled 2.7 million kroner, which is a 116% increase over the prior year period. Sales in the US are on a research use only, or RUO basis, and they reflected to a certain degree the timing of customer orders. The NGAL test sales in the rest of the world totaled 1 million kroner, which represents a solid 10% increase over the prior year period. Overall, as I shared on the prior slide, the NGAL test total revenues were 3.7 million kroner during the quarter ended March 31, 2022, representing an increase of 70% over the prior year period. Turning to operating results for Q1 2022, the EBIT loss for the period was 18.2 million kroner, almost to the kroner the same level as the prior year period. Adjusted EBITDA of 15.2 million kroner for Q1 2022 represented an improvement of 0.5 million kroner compared to the prior year period. Looking at our cash burn, we reduced the cash used in operations and net investments in Q1 2022 from 21.3 million kroner in Q1 2021 to 17.1 million kroner in Q1 2022. This 4.2 million kroner improvement was principally related to our management of working capital. Moving to the balance sheet, on March 31, 2022, BioPorto's cash position was 27 million kroner. But as you likely know, we completed a rights offering on April 1st, 2022 that provided net proceeds of 93.1 million kroner. Therefore, on a pro forma basis, our cash position was 120 million kroner at the end of the first quarter. The 93.1 million kroner increase in equity from the rights offering is already reflected on the balance sheet as of March 31, 2022, because the offering was bound before the end of the quarter. The gross proceeds and expenses from the offering are classified in our March 31, 2022 balance sheet in other receivables and other payables, respectively. Finally, I'd like to briefly review some details of the offering. The company raised, as I said, 93.1 million kroner in net proceeds from a fully subscribed preemptive rights issue announced in March 2022, with binding commitments in March and a financial closing on April 1st, 2022. 66.9 million new shares were offered at a subscription price of 1.50 kroner plus 4 subscription rights. These proceeds are enabling our team to focus on BioPorto's strategy to deliver the NGAL marker as the new standard of care in assessment of kidney health, prepare the company to commercialize and scale, and build a strong team dedicated to our mission. As Tony and I have described previously, the offering was an important part of our long-term capital plan that includes a potential U.S. listing. Since the U.S. is the largest market for in vitro devices, including the NGAL test, we plan to build a dynamic presence there to support our future customers. Now, handing it back to you, Tony, for closing remarks.
Thank you, Neil. As I stated in the introduction, I believe we are off to a good start in BioPorto with this first full quarter from our new team. We are on track with completing enrollment for the study's objectives and preparing submission for the NGAL test to the US FDA. We have implemented a focused strategy, closed a fully subscribed share issue, and have closed the books for Q1 2022 with a solid growth trajectory and a cash burn in line with our expectations. In terms of financial guidance for 2022, we remain on track to meet our guidance as most recently stated in the annual report for 2021. Specifically, revenue of approximately 24 to 26 million krona, EBIT loss of approximately 95 to 100 million krona, and adjusted EBITDA loss of approximately 76 to 81 million krona. As can be seen, the adjusted EBITDA loss this year will be higher than last year. This is due to higher costs related to sales and marketing compared to 2021 to prepare for commercializing the NGAL test in the US, and increasing costs to expand support for distribution in the rest of the world. Similarly, costs related to R&D are planned to increase over 2021 levels as a result of a full year impact of 2021 hirings, investments in quality systems, and other costs related to preparing and submitting the de novo application of the NGAL test in the US to the FDA. Finally, the full year impact of hires of management and other team members will also increase the adjusted EBITDA loss compared to last year. These are all investments in the future of BioPorto that I believe will prepare the company to execute on our strong potential after we have expectedly obtained clearance to sell the NGAL test in the US. On a final note, I want to express my gratitude to all of our employees for their hard work and dedication during my nearly 6 months at BioPorto. We have accomplished a lot in this short time, and our focus is on delivering results. The theme I shared during our annual report has not changed. It is focused on executing our strategy and achieving our financial targets. And importantly, I am focused on keeping you and the market informed on our progress within the framework of what is prudent to disclose, considering both NASDAQ rules and the competitive environment. Therefore, to increase transparency and strengthen our shareholder dialogue, we have decided to hold a monthly call where we will take questions and, to the degree possible, provide answers to what is top of your mind. Following this call, the next monthly call will be in June. So please watch for the invitation, which will come from our trusted partner, HC Andersen Capital. With that, I will hand the call over to you, Henrik, as we are happy to take questions.
Thank you very much, Tony, and thank you very much, Neil. Well, let me begin by, as I can already see in the chat, that there are others that has applauded the very strong results. Could you perhaps elaborate a little bit on the composition of these increased sales of the NGAL test for research only? It's just to get an idea. Is it the same customers buying more per customer, or is it an increased number of customers buying sort of the typical average amount of NGAL tests?
Yeah, we do get new customers, fairly frequently, but I would say the majority of the impact in Q1 was as a result of customers buying more NGAL test, as well as basically all the customers, or most of our customers, ordering in Q1. Like I said, there may be a timing impact as well, as we don't expect all customers to order every single quarter.
There's a question relating to the NGAL research only sales, which are up very much. The ELISA product and the antibodies business, is there still focus on this, or how should we interpret this? Are there resources allocating to continue selling this, or how should we understand it?
Absolutely. And as I indicated before, we will not stop focus on selling antibodies or ELISA kits. Antibodies and ELISA kits are somewhat cyclical in their order pattern. Whenever a new study has been started, they'll order a number of antibodies, a number of ELISA kits. We'll get, so there is some bumpiness to that particular business. But we continue to pursue it. We continue to work with our distributors to market and take orders on those kits.
And follow-up questions relating to the NGAL test. There's a question here if you can clarify whether it's approved in Europe and what the expectations are for revenue in Europe.
So the test has a CE mark, which allows it to be marketed in Europe and other countries that recognize the CE mark as their registration certificate. Right now, the sales are primarily through our distributor partners, and they'll sell to laboratories throughout Europe. It has been on the market for a little while. However, there hasn't been a strong focus on assisting those distributor partners in the sale of those products. That will be our focus in this coming year. It is our focus right now to provide the distributors with the tools, with the education, with the clinical support to actually sell those tests in order to gain traction throughout Europe.
You mentioned the ongoing process of enrolling patients and ultimately analyzing the data and submitting the application and so on. There's a question relating to try and clarify the timing of when the application will be submitted. You have the results; these will be analyzed, and what should we expect in that regard?
Yeah, so I'm not prepared to talk to the actual timing of the submission itself, not until we get the data in hand and we've analyzed the data, make sure that we have all the data that we need to perform the submission.
And then there is a good question, I think, actually, because this relates to some sort of qualitative assessment of your product from the customer's point of view. What is the pushback and the feedback you get from as you sell this product and it's being used in the clinics? What are the feedbacks you're getting?
Yeah, I mean, the customers seem to be very satisfied with the actual test itself, with the results they are getting from the test, and with the ability to load it on their existing instrumentation. Please remember, we do not provide incremental instrumentation to the accounts to run the test. They actually run it on their standard clinical chemistry analyzers. And fortunately, we were able to design the test in a way that it's no different than other tests that they run on those analyzers.
So as you engage with customers to sell the product and they try it, and do you make adjustments to the products in any regards so that it works on these different equipments already in the hospitals?
Yeah, so you have to run a calibration process with controls in order to set up the instrument to run the test. It is not a major set of activities that is required. It is something that the laboratories are very used to doing, not only for our tests, but for other tests, new tests that they add to the instruments.
Yeah. Turning back to the presentation, you had this 18-month strategy with 3 points. Of course, getting the NGAL test approved, and then you said preparing for commercialization and scale of the business. What does that actually mean in terms of your outsource all the production, or what should we how should we understand this?
Yeah, so what this means is looking what we need to do to scale the production. Well, on the commercial side, it's basically adding personnel and looking at our sales channels throughout the world to make sure that we can maximize the presence and market adoption of the test. On the production side, we are looking at all our processes and our supply chain to determine what it takes to actually scale this on a volume perspective. That being said, when it comes to antibodies, it doesn't necessarily take a lot to produce a lot of antibodies. And when I talk about antibodies that support the NGAL test. But we will always look at whether we build or buy, right, in terms of our production capacity.
Turning to, you mentioned the breakthrough designation status of the process for life-threatening diseases, but you also mentioned in the report that there's neither approved or cleared alternative that exists at this point. But ultimately, how does the competitive landscape potentially look like after you have reached this approval? Will there be, as far as you know, other similar tests that are waiting to be approved as well, or how should we understand this?
Well, to our knowledge, nobody is pursuing an NGAL biomarker test. However, that being said, our success will draw attention, right? And you will have other companies taking a look at how they can provide something similar. That being said, they have to go through the same process that we have to get that regulatory approval. Will there be an emergence of competition in the future? Most likely. That being said, with our intellectual property, with our know-how on how to produce this test, and with our first mover advantage, we believe that we can get a lot of market in a very short amount of time, while others prepare to introduce their own tests.
Okay, so because it's my understanding that, for instance, the provider of equipment, one of their providers at the hospitals, Abbott, also have had or still has, I don't know, some development of some sort of test as well. And if they were to provide, would you still, are there any pre-agreements as to you can continue on using their equipment in those hospitals, or what is the framework?
Yeah, so Abbott will have to take a look at what is required for for them to actually invest in this. Their test is also, I believe, a serum-based test, whereas ours is a urine-based test. So yeah, like I said, we'll have the first mover advantage in the know-how and the KOLs to support us in moving this forward.
There's a question relating to what you also briefly mentioned in the presentation of these other biomarker tests that could be potentially developed. What could that be, for instance, just to put some flavor on that?
Well, we have talked about the Thrombomodulin Test, which Riggs University Hospital has. Hospital Ed, I should say, has been testing for the as a companion diagnostic, almost to prostacyclin for endothelial damage. That is one that we're continuing to evaluate. We have a number of other antibodies that I'm not prepared to talk about right now, that I want to get further along through the discovery process before I start, talking about them to the open markets here.
Okay. Then there is a question, I guess, for Neil, concerning the cash position and cash burn. Assuming the current monthly cash burn, how many months will you be able to run before you have to make a next share issue? I don't know if you are able to comment on those sort of things, but perhaps you could elaborate on
that. Thank you. I'm happy to provide some context for that. I think as to begin with, as I shared in the prepared remarks, we had a favorable improvement in the rate of our cash burn during this quarter versus the first quarter of last year. There's a slide that illustrates that as well. As I'm sure the audience knows, that when you put out a set of financials, that implies that there's 12 months associated with that, and at least at a minimum. So that's implied in the financial statements. On prior calls, we didn't spend a lot of time talking about it today, other than the fact that certainly this most recent rights offering is part of our long-term capital strategy, which includes getting access to capital in the U.S., which may include a listing here in the U.S. That's something that Tony and I and the board are continuously evaluating as we think about our capital structure and when and how might that make sense for the business. And as we move along that process and have more to talk about, we'll certainly be certain to share that.
Yeah. If we turn, I see the time is running, but in terms of you discussed this already, that you're moving from the pediatrics market, hopefully when you get approval here, and subsequent try to get into the adult indications, but still in the hospitals and clinics. But there is, as far as we understand from both your prospectus and previous presentations, a very big potential market in emergency departments, ambulances, and also at general practitioners and things like that. Can you try and elaborate on sort of the journey from this very narrow indication and to these bigger markets potentially?
Yeah, so we haven't made final decision on what our next indication will be for NGAL. We are initiating a process with our scientific advisory board to identify what market will have a high impact, as well as is very feasible, right? So high impact, very feasible for us to move forward. And when I say feasible, I'm really talking about timeline, right? It's what can be done in a very short amount of time. We have a certain minimum levels of market size in terms of timelines, in terms of economics, what kind of resources will be needed to actually execute on that particular indication moving forward. So that process will start shortly. And when I say shortly, I will tell you that it's likely at the time we do the submission to the FDA for pediatrics, so that we keep the focus for our employees on that particular milestone first. And then, while the FDA is reviewing the pediatric indication, we will make plans on executing for the adult indication. And as part of that, we will have pre-submission meetings with the FDA. So that, again, like pediatrics, we will have the exact plan on how to introduce this to the FDA in terms of the data collected, in terms of what the submission package would look like.
And if I could add on one thing to that, please, Henrik, I know we're just about out of time, is that the good news is that to the credit of Dr. Chris Bird, our Chief Medical Officer, and our entire scientific team, and as people who are familiar with NGAL and the thousands of publications that have been produced, peer-reviewed publications by clinicians around the world around it, there are a wide range of indications that we can explore once we go beyond adult NGAL and acute kidney injury. So that creates a lot of optionality for the business, and we believe a lot of opportunity for the business as we grow it moving forward.
Okay. So with that, I think that will be very interesting to follow this. And so it's not just about the pediatric market, but it's actually about these additional and much bigger markets going forward. So it'll be very interesting to follow. And as you said, we will perhaps be able to touch more upon that in the coming Q&A sessions that we will host in June. So with that, a very warm thank you to Tony Pereira and Neil Goldman from BioPorto, and thank you for all the questions from the audience. So I wish you all a very good afternoon. Thank you.
Okay, thank you, Henrik.
Thank you, everybody.